I'm Dr. B from AC Villarreal Family Dental in Edinburgh and Dental Associates in Farr and McAllen. Today we're going to be talking about dental crowns. You know, all too often I'll have a patient that will ask me, "Hey doc, is it a possibility that this tooth might require a crown?" And to help you understand that, we really need to talk about the three circumstances where a crown is necessary. You know, the first instance where a crown might be necessary on your tooth is really pretty straightforward. That's any time that a root canal is done on one of your teeth. In particular, any of these posterior teeth in the back. The American Dental Association recommends that a crown is placed on a root canal treated tooth within the first 3 months after the procedure is done. The reasoning is really very simple. That's because any time a root canal is done, the vitality is removed from that tooth. So this includes removing a nerve, removing the arteries, removing the veins from that tooth. What this does long term is that tooth is no longer able to heal itself from outside insults, like cracking on a walnut a little too hard. Getting that crown on a root canal treated tooth ensures that this tooth is going to be able to stay in your mouth for the next 20 to 30 years. The second instance where a crown would be beneficial is whenever we have a crack that has developed on our tooth. Sometimes this can develop from trauma. Sometimes it's a normal wear and tear thing that can occur if, for example, an older amalgam filling has been on a tooth for too long. Whenever we find and diagnose that there's a crack in a tooth, this is very similar to finding or receiving a shot on your windshield when you're driving on the highway. We all know that if you get a shot on that windshield, that crack is going to continue to run, and it can become very problematic in the long run. This is very similar when it comes to our teeth. Getting a crown on a tooth that has a fracture can prevent this tooth from ever needing a root canal, and once again, can make sure that your tooth stays in your mouth for the next 20 to 30 years. The third reason why a crown might be necessary in your mouth is if there's a large cavity that a filling just won't do. Fillings have their place in dentistry, but if the proposed filling is a little bit too large, physics aren't going to hold it in place, and sometimes there's a threshold where we have to go up to the crown. If that filling is just a little too large, this crown is placed on top of that tooth to ensure that there's a nice good seal on that tooth, and so no bacteria is leaking in. So those are the three reasons why a crown would be necessary for your health. Now, some of the other things that I hear are people have some reservations about crowns for different reasons. You know, somebody's asked me before, "Hey, doc, what does this crown look like? You know, I don't want any gold or metal in my mouth. You know, I'm a young guy, or I'm a young girl. I don't want gold crown." We're living in modern times. Nowadays, we use the most futuristic, modern zirconias and ceramics. So nowadays, we can make tooth-colored crowns that are pretty darn close appearing to normal teeth. At our offices, we use CEREC technology. And so one of the other things that people will have some concerns about is what is a turnover on a tooth like this? Recent audits in our offices have shown us that 95% of our crowns are done on the same day. Now, another thing that I have heard in regards to whether or not a crown is the right choice for somebody is, we've heard these horror stories where somebody's had to use a temporary for 2 weeks or a month. They had to take a goopy, gooey impression. That CEREC technology that I referred to earlier is revolutionary in its ability to take a digital scan, and then as the doctors, we can design, mill, and bake that crown and have it ready for you within an hour and a half. I hope that this has been illuminating for you. And if you have any other questions moving forward, please reach out to our dental management team with any questions. We look forward to seeing you.